diarrhea, fever, joint pain, mouth and genital ulcers, muscle soreness, night sweats, rash, sore throat, swollen lymph nodes. These are the symptoms of AIDS. Acquired immune deficiency syndrome, or AIDS, is a life-threatening disease caused by human immunodeficiency virus, or HIV. How does HIV cause AIDS? Dr. Ron Strauss, professor at UNC-Chapel Hill, executive vice provost and chief international officer of the university, explains.
They're not the same. You get infected with the HIV virus, the human immunodeficiency virus, and you don't get AIDS right away. AIDS is a disease that occurs over time. You can be infected with the HIV virus and not know it, or you could have a kind of a flu-like symptom, and yet for many people, lots of years can go by before they realize that something else is going on.
Scientists, doctors, activists, and even the general public have been searching for a cure since it was first identified as a disease in 1984. In 2010, 34 million people around the world were living with AIDS. 1.8 million of those people died from the disease. 25 million people have died from AIDS since 1981. These numbers will continue to climb because there is no cure. Until now.
There's only, as to my knowledge, one case of somebody who's claiming a true cure, and that's somebody who had a bone marrow transplant.
Mr. Brown is also known as the Berlin patient. In 2007, Brown was living with AIDS as well as leukemia. After undergoing a treatment that was supposed to rid him of his cancer, Timothy Ray Brown was cured of AIDS instead. The transplant treatment suppressed his cancer for just only 1 year.
A cancer, and after the transplant, with the bone marrow transplantation, just wipes your whole body's immune system clean, basically, and they claim that at the same time they were really cured. It's a very drastic treatment. It's not something you would advocate under a normal circumstance.
Population possessed the genes that contain the mutation that apparently cures AIDS. This mutation was apparently inside of the bone marrow that was transplanted into Mr. Brown. The bone marrow of a person with a mutation called Delta 32 has a natural resistance to the HIV virus. It has been proven several times that when doctors and scientists thought they have cured AIDS, instead they had just made the virus count in the body so low that it was undetectable.
But what it is you can suppress the virus so far that it's what's called undetectable. People by normal tests can't find the virus, but as soon as you stop treating that, as soon as you take the drugs away, the virus rebounds.
So the big question is Timothy Ray Brown actually cured of AIDS?
Probably is cured. I mean, I believe that they've done all the tests they can possibly do and they can't find virus. But it's such an unusual circumstance that it's not generalizable to other populations.
From a doctor's standpoint, some would say yes, but some would say that somewhere in his body the virus still lives on. His symptoms may be completely gone, but for some that is not enough to say that he is definitely cured.